Welcome to another edition of Healthful Conversations with SSM Health. I'm Julie Tristan. October, Breast Cancer Awareness Month. So that's what we're going to talk about this month. I have Dr. Kate Appleton, a breast radiologist from SSM Health DePaul Hospital, here to talk all about this really important topic.
Thank you so much for having me. Breast Cancer Awareness Month is right around the corner, so we need to start talking about getting those mammograms.
All right, here's your first question. When is it time for a patient to start adding mammograms to their regular healthcare regimen?
That's a great question. So for women with an average risk for developing breast cancer, we recommend beginning at age 40 and coming every year thereafter. So that's your annual routine mammogram. For women who have a family history or other risk factors that would elevate their lifetime risk for breast cancer, they really need to reach out to their provider and know their risk. Their individual risk will help us know when we should begin screening because it could be as early as age 30.
And what can a woman expect after her screening mammogram?
So some women have concerns and fears about coming in for their mammogram, that it'll be painful or uncomfortable. It's very well tolerated by women. That's why we have so many women coming back year after year to take good care of themselves. After the fact, women can expect to get their results in a few days, typically. And those results may come in the mail or in an electronic medical record. The good news is 9 out of 10 women will get a note saying, everything looks great and we'll see you next year. For about 1 out of 10 women, they will be invited to come back for some additional imaging. Of the women who are invited to come back, overwhelmingly, they also get good news.
What are the different types of mammograms and why might they be used in different circumstances?
So as we just talked about, screening mammography, we know saves lives. That's your routine, your regular once-a-year mammogram. Screening mammography is for women who don't have any symptoms. This is just something you're checking off your list to take good care of yourself. For women who might have a symptom that could suggest there might be a concern, like a lump, she would get a diagnostic mammogram. That allows us to get some additional pictures, really tailor the exam to whatever the area of clinical concern is. And then also for those women who are recalled from screening, they too will get a diagnostic mammogram. So it's always very important to let your technologist know if you come for your screening mammogram, but the night before you're thinking about it and you realize, oh, there's something of concern, definitely speak up and advocate for yourself because you don't want a screening exam at that point. You'll need a diagnostic.
If you're a person who has never had a mammogram before, where to get started?
So if you're 40, you need to give us a call, come online and make an appointment to come in for your first mammogram. If you're under 40, let's start thinking about who in your family might have had breast cancer or possibly ovarian cancer. Talk to your provider to determine if maybe you need to come see us before you're 40. And we just want to encourage women to come in. Some women have been delayed because of COVID. We're all behind on a lot of our healthcare maintenance. The time is now to come on back in. Let's check this off your list and take good care of yourself.
Thank you so much. A lot of good advice, and get the mammograms. They're not so bad. I've had like a couple now and it's fine.
And it could save your life. It is well worth it if it could save your life.
Well, Dr. Kate Appleton, breast radiologist, SSM Health DePaul Hospital. Thank you so much.
Thank you very much for having me.
Don't forget, October is Breast Cancer Awareness Month, so go get your mammogram. This has been another Healthful Conversation with SSM Health. You can find out more at ssmhealth.com.